everybody. Thank you for having me here again. I think it's been probably at least a year or more since I came to this meeting. Carrie is on our staff, as you know, Carrie McBee, and she comes more regularly than I'm able to, but I'm really happy to be here again. In case you're not familiar with the Missouri Budget Project, let me give a little 1-minute introduction to us. We are a nonpartisan, nonprofit fiscal analysis organization. We were formed in 2003 because of the state's fiscal crisis and the budget cuts that were happening to really look at budget and tax issues and get the information out to people so that individuals throughout the state can become engaged in those debates in Jefferson City. A lot of really critical decisions are being made, as you know, in Jefferson City, and we didn't want just the politicians in the Capitol to be making those choices. We wanted people to be able to have a strong voice in these discussions. So we now have 5 staff, 2 of which who are located in the middle of the state. That includes Carrie McBee and Tom Kruckmeyer. Carrie's our outreach coordinator, and she's also working on federal issues. And I believe she's going to be talking to you all next week about some of the federal issues. Tom Kruckmeyer is our chief economist, and he's going to be here, I think, in 3 weeks, talking about the tax and revenue issues that happened this year. And Ruth Arisman, who works with me in our St. Louis office, is our director of health policy, and she's going to be here in about 2 weeks talking about health care, more specifically the Medicaid situation and the Health Net bill that was passed. But I am here today to kind of give a big overview of what happened this year in the legislative session. It wasn't the worst session because there were some small victories that I do want to mention, but it wasn't the best for working families and for seniors and for people living in poverty in Missouri. We clearly did not advance very far this year. The majority party in Jefferson City had some issues that they wanted to advance, and including Medicaid, the restructuring of Medicaid, including some tax cuts, and including some changes to higher education, and I want to touch on all 3 of those today. First of all, on the Medicaid side, you know, people are hearing a lot, I think, about the new Missouri Health Net that it's going to be taking the place of Medicaid in Missouri. People don't understand that broadly does not restore health care coverage to the people who lost it in 2005. There were, in 2005, at least 115,000 people who lost access to health care because of the Medicaid cuts. Probably closer to about 150,000 people actually lost eligibility, including children, including working parents, including people with disabilities, and seniors. They all lost access to health care because of the 2005 Medicaid cuts. This year, the legislature broadly did not restore those cuts. The Health Net proposal does not bring all those people back in. There are some restorations, mostly for children. There were about 5,000 children of the 50,000 children who lost coverage who were restored. There were only about 10,000 people who will gain health care through Health Net who didn't have it previously. So less than 10%, probably closer to 5% of the people impacted by the 2005 Medicaid cuts will actually get health care back. One of the things, in addition to this, that has been discussed is that the legislature has talked a lot about restoring, or Governor Blount has talked a lot about restoring things like dental services. Well, dental services were not really restored, and you should know that. For the people who retain access to Medicaid, dental care is still subject to appropriations. And this year the legislature did not provide funding for dental care. So about 300,000 people who are eligible for Medicaid are still not eligible for dental care. We know that the healthcare crisis in Missouri is increasing rather than decreasing. We know that other states have looked at comprehensive proposals to actually increase access to health care. Massachusetts, as you know, has made some significant changes recently. And while we don't know, because all of it has not been implemented yet, the Missouri HealthNet proposal is sure to not provide the comprehensive health care reform for Missouri. We know that there are at least 700,000 people in the state who don't have access to health care right now, who are uninsured. And then an additional 100,000 people who lost health care because of Medicaid. We've got a real crisis. I mean, that's 800,000 people of a 5.5 million person population, and that's very significant. So that's one of the areas that we were very disappointed in, was that some of the, quote, surplus revenue this year wasn't used to restore coverage for people who lost Medicaid. Again, this is a priority for Missourians. We did a poll a couple of years ago that had some of the same information, but there was a poll more recently done by the Missouri Foundation for Health of Missouri voters. Across the board, voters absolutely support Medicaid and support the creation of a comprehensive solution to the healthcare crisis. There's about, and the poll's available on the Missouri Foundation for Health website, the most recent poll. But what I remember from it is about 85% of Missourians are opposed to the cuts. So that crosses all political spectrums. You know, there are only 15% of us that think it was okay. I don't know who those 15% are, but they're someplace in the state. And Ruth is going to be here to talk more about the healthcare structure in a couple of weeks and talk more about what HealthNet means, but I just wanted to give that overview. Another thing that is concerning about healthcare is that the legislature passed House Bill 818, which was intended to be an insurance reform package. One of the things that was tagged on to that package, House Bill 818, was a measure that allows the state to begin collecting medical debt for hospitals. So imagine this. Someone who lost Medicaid, a low-income mom, let's say, in a family of three with an income somewhere between $292 a month and $1,000 a month, gets sick, goes to the emergency room, racks up a medical debt at the emergency room. The state will go after her to recoup the funding for the hospital. That was something that kind of snuck in there that people need to know about, and that's very concerning. Incidentally, the hospitals didn't want that. They didn't ask for it. They say they didn't want it. Related to K through 12 education and higher education, the governor has been talking about putting increased funds into those areas, and it is true that there has been an increase this year for K through 12 local school district funding as well as higher education funding. However, the K through 12 funding increase is about $132 million, which was required by the new school funding formula that was passed 2 years ago. That school funding formula is still about $500 to $600 million below the required funding levels. And as you probably heard, many school districts have bonded together to sue the state because of this. And we're not sure what that's going to mean yet. You know, there's a real possibility that the state will end up owing the school districts a significant amount of money in a very short period of time, and that will be good for schools, but without any sort of funding increase, bad for all of the other services that we care about. Higher education received about a 4.5% increase this year, totaling $38 million for Missouri public universities and colleges. That amount is just now reaching the funding level that was attained in 2001. just now reaching the funding level. Doesn't even account for inflation or any increased needs. And I'm sure that you've heard stories locally about what's happening at the university here as a result of strained funding, but the universities throughout the state are increasing tuition at dramatic rates. Tuition is increased by 60% over 5 years as a result of the decreased funding. Child care in Missouri, the eligibility has been one of the lowest for child care subsidies for low-income families who are working, the lowest in the nation. At one point I heard we were number 53 in the nation. And I questioned that. How can we be number 53? There are 50 states. Well, we were behind Puerto Rico, Guam, and the U.S. Virgin Islands. That's how we became 53 in a nation of 50 states. There was some attempt, and there was a strong attempt actually, on in both chambers to increase child care subsidies, eligibility for child care to 185% of poverty from about 108% of poverty. However, the legislature in the end only increased the funding to allow for an increase to 127% of the federal poverty level to be eligible for child care. So we know that there are going to be many families who are still left out and struggling to meet their family's needs and pay for child care if they want to work. There simply was not a lot of money put into that program. All told, these items, if you add together, K through 12 education increase of $132 million, the higher education increase of $38 million, and the child care increase of about $7 million, that ended up being about $170 million. Well, at the beginning of the legislative session, the governor and the majority party were talking about having a $300 million surplus, okay? And that surplus would grow into an amount of $500 million by the end of the fiscal year, which happened June 30th. Of the $500 million, the state only invested the very basic requirements into these services. We did not broadly expand or invest in the services that impact all of us. And in fact, what we've done is we've moved from having a surplus to having a big, huge budget hole that will be coming within the next couple of years. The legislature passed about 4 tax cuts, 4 different tax cut packages this year, most of which were aimed at corporations and eliminating tax cuts or taxes or reducing taxes on corporations. Those included Senate Bill 30, House Bill 327, and blanking on the last one. But the 3 bills that were directed mostly at corporations, of those 3 bills, only one was vetoed by the governor. And it was vetoed because it had technical issues and technical problems within the language of the bill. And in fact, it was really a mess. What they did in the last couple of weeks of the legislative session is they rushed this bill through. The governor said this bill isn't written correctly, and the legislature tried to fix it by passing amendments onto different bills that didn't pertain to take out, remove, or adjust different provisions in the bill that they had already passed. It was pretty crazy. It was really pretty crazy. That bill was thankfully the one that the governor vetoed. However, there's probably going to be a special session to consider that bill. It's probably going to be sometime in late August, possibly even concurrently with the veto session in September. So we expect some modifications, but some sort of bill to pass. And in the end, what the total cost of all those bills are together is $250 million per year, cut from the revenue base. Because of the Hancock Amendment, these tax cuts are fairly permanent in the state. The people, because of Hancock, in the state's constitution, have to vote for a tax increase, for any significant tax increase. Anything over $75 million is considered significant. So any tax cuts that are passed face the unlikely, very unlikely, chance of being restored by a vote of the people. So these become pretty permanent and will have a pretty devastating impact on our revenue situation. The revenue in the state is expected, even with the regular growth and with the regular costs, increasing needs for the school funding formula and so forth, we're expected to see a very small shortfall by next year, maybe about $50 or $60 million. But by fiscal year 2010, in 2 years, we're facing at least a $500 million shortfall, budget shortfall. This will be incredibly severe because it's going to be on top of the reductions that the state has already made. You know, the reductions the state has already made to Medicaid, it's already made to education. We know, I've got to bring up the transportation situation, obviously. The director of the Department of Transportation this week was talking about the need for transportation funding. And given what happened in Minnesota, I think it's important to say that yes, you know, transportation is a significant issue in Missouri. I mean, we are already 41st in the nation as far as our level of funding for transportation needs. We expect the transportation budget to face a shortfall within that same time frame, and drop from the current revenue of about $1.2 billion down to $569 million by fiscal year 2010. What that means is our aging infrastructure needs, our bridges, our roads, and so forth are going to face a lack of funding as well. The Transportation Department refuses so far to say what their solution is, but I have to say, you know, there's no free lunch in Missouri, right? We have got to start looking at investing in all of these services across the board. We don't want a repeat of Minnesota, but we certainly don't want roads to take precedence over education or health care, right? So we need to start looking at how we fund everything. My guess is that what we'll see in the next couple of years are several proposals that may be going to the ballot asking for the people's support of health care and the people's support of transportation funding. I am not clear yet whether or not the people in the state are going to understand the revenue situation enough to vote for those increases. So it's going to require all of us talking with our neighbors about why we're facing a shortfall, you know, and what you get from what you pay into things. To summarize that piece of this talk, the governor keeps talking about having a surplus, you know, having created the first surplus budget that Missouri has seen for several years. But that came at a huge cost to the services that Missouri offers its citizens and at a huge cost, clearly, to the budget in the long term, right? The budget is not going to be seeing surplus for multiple years here. Another thing that happened that has to be mentioned is the sale of Mohila. The Mohila sale brought in about $350 million in funding for capital projects. However, what we've done is we've sold off an asset in the state to fund ongoing needs. Right? Think about it in your personal situation. Right? If you in your household have an ongoing, budgetary need, whether it's food, housing, your mortgage, your utilities, anything, clothing, and you sell something, like your car, to get, short-term funding influx for that ongoing need, it doesn't make much sense. In the end, you're going to be facing a large hole again, and you're going to have to look for some more sustainable situation for revenue. What happens in addition with the Mohila sale is that a short-sighted policy was put into the bill that actually caps future tuition increases at Missouri universities. The bill does not say, while we may think on the surface that capping tuition increases sounds good for Missouri young adults and kids who are just starting out, and it is a good idea, probably to cap to a certain extent. However, given our budget situation, we are not going to have the funding available in the state general revenue to make up for the difference. If tuition is capped and the universities aren't allowed to increase it to meet their needs, the state's not going to be able to come in and put the funding into the universities that they need. So our universities will suffer, and the quality of the universities will suffer, and the class size will likely increase, and course offerings may decrease over time. The last thought that I would leave you with on this before taking questions is that, all of these were the significant issues that passed this legislative session. The budgetary issues, the health care, the Mohila, and now transportation is a growing issue. And I have to say, Missouri's current leadership did not do what they could have for working families in the state, and did not invest what they should have for working families in the state. So, any questions? Yes?
In your handout, you refer to the Mo Health Net legislation, and you say that they increased the eligibility to 185%, and then you have a sentence. This has been limited in other states, most likely to assist those on incomes above the poverty level rather than those who are uninsured, because their eligibility for Medicaid was cut in 2005. And I don't quite understand why they wouldn't be eligible if they're under the poverty level.
Okay, I'm sorry, what page are you? Oh, you're looking at the Senate Bill 577, yes.
Very back.
What happened was, that should have been probably, that goes with the sentence prior to that. What they did with Senate Bill 577 is they kept the Medicaid eligibility levels for the most part where they are. So a working family, a mom with a parent of 2 children, can only earn $292 a month and qualify for Medicaid. Anything above that, she is not eligible because her income is too high. So that's 17% of the poverty level. What they've done is they created a premium assistance program for people to buy into health insurance policies. And that eligibility is, you can be eligible for that up to 185% of poverty. That's a pilot program. And that pilot, what we've seen in other states, first of all, premium assistance programs have a very low pickup rate, very low pickup. Maybe 2% of the people who are eligible actually take advantage of them. And you have to, because it's a premium assistance, they're not paying for your entire premium benefit necessarily. You have to be able to have some disposable income, or any income really, to pay into it yourself. So imagine if you're making $300 a month, in a family of 3, you're not going to be able to do that. So people who broadly live under the poverty level are not going to be helped by this. This premium assistance program may help those who are just above poverty, but not those who are living within it.
So if they already don't have money to pay for insurance, they're not gonna be able to pay for insurance.
You bet. Even at a reduced rate.
There's
Yep.
there's a question here on eligibility, just to back up on that. The poverty level's based on Health and Human Services federal number, or is it a different number?
No, yes, it's the federal number. The U.S. Department of Health and Human Services every year in April comes out with new poverty figures.
Right.
And so across the board in the various states tend to use, that's the number that they use. Yes?
You have numbers here disclosed. Let me put this into perspective. There's a revenue problem in Missouri.
Yes.
How does Missouri stack up in terms of revenue per capita, deducting pass-through funds compared to the rest
Other
of the country,
states?
particularly places where Missourians would like to think they could compete socially and culturally like Guam?
Yeah, we are 40-something in every tax or revenue indicator in the nation, 40-something. In some cases, we're way down at the bottom. For instance, our corporate income tax is 46th nationally, and there are 4 states that don't assess any corporate income tax. So we are the bottom of those that do. And, you know, one of the arguments against assessing a corporate income tax is that you will impede the growth of business. Well, clearly there are not corporations knocking down Missouri's borders, right, to come in, and we're 46th already. So if that correlation were true, we would have more businesses, we would have a larger economy than we do. That's one example. Another example, you know, we're 41st on fuel tax. You know, all of our taxes are very low, down in the 40s.